Hello friends, welcome back to my channel Medicine of Onziron. Today we'll talk about kidney stones or renal stones. So it's the basic topic regarding the pathology and surgery. So I'll just do the overlap in between the surgery and the pathology. So discuss this topic. So it's one of the quite familiar topic. We know the renal stones. It's very familiar. Some of you may hear that terms that someone is having the renal stones. Okay, from your family or from your relatives, whatever you can say over here. So before the renal stones in details, let's know about the types of the renal stones. Now the most common type of the renal stone, that is what? Calcium oxalate. Okay, that's the calcium oxalate. Now calcium oxalate. What's the reason for it? Okay, let's see this one. The main reasons for forming the calcium oxalate containing the stones, that is what? Okay, in these cases we will get idiopathic, actually it's idiopathic hypercalciuria. The reason for it, you can write in this way, that idiopathic hypercalciuria. Okay, in this cases. Now, when you are talking in this way, that we will get the idiopathic hypercalciuria, definitely there will be the depositions of the calciums, and along with that we will get what another thing we have to know over here, that in this case, if we just check the 24 hours value for the calciums within the urine, then we can come to know whether it is for developing for the calcium oxalate or not. So 4 hours we have to monitor the calcium level within the urine. Okay. Now whenever once we have understood or we have confirmed that yes, it is the calcium oxalate, what type of treatment we should go for it, what type of treatment we can do for it. So first times we are supposed to use what? As we know that whenever we get the calcium oxalate, what type of the drug we are supposed to use? We will use the thiazide. We'll use thiazide. Because in thiazide, whatever thing we'll see, whenever we'll see the thiazide, there is a less chances for the calciums to go within the excretions. So thiazide, so less chances for the calcium were within the urine. As a result, we will see what? The less chances for the formations of the stone. So stone formation chance, that will be also less over here. Okay. Now see, what can you do on what type of the tree, what type of stones will get over here. The types of this stone in this case is, if we just see your microscopic findings, we'll get the stone shape in this way. The stones that will be looking like this. Envelope crystals. These are known as envelope crystal. So this type of the shape we will get in terms of what? Calcium oxalate stones. So we have to use the thiazide, because the thiazide, that will reduce the load on the renal tubules for the calciums. So there will be less chances for the calciums to get precipitated over there. So less chances for the formations of the stone over there. Okay. Now, along with that, if I say that, can you use the furosemide? If I say, for example, the loop diuretics, can you use the furosemide? No. I'll say we cannot use the furosemide. Why? Because see, when you use the furosemide, that will increase the calcium excretions through urine. So whenever it is increasing the calcium excretions through urine, at the time there is a chances for the depositions of the precipitations of the calcium. So the chances for the precipitations of the calcium are within the urine. So whenever the chances for the calciums to get precipitated over there, the chances for the renal stones is more. So the chances for the renal stone, that will be more. Along with that, whatever the dietary control we can see over here, some individuals will say that definitely we should inhibit the calcium intake, but not in the recent study we have come to know that if we use the calcium intake, at the time the condition that will be more bad, that will go to the worst. So in these cases, if I say that calcium intake should not be inhibited, calcium intake, that should not it should not be inhibited. That means we can continue the calcium intake. That means the individuals can have the dairy products. But the problem is over here, we can restrict the sodium. We can restrict the what? Sodium intake. So we can restrict the sodium intake over here. Okay, let's see. So the sodium intake that should be inhibited. In these cases, there is less chances for developing the calcium oxalate stone. Calcium oxalate stone. Okay, repeat once again. The most common type of the renal stones will get over here. That is the calcium oxalate, and what type of the findings will get over here? The envelope testes. This type of the stones will get over here. And if it's in terms of the treatment, we can use with the thiazides, because the thiazide that will reduce the load of the calcium in the tubules, renal tubules. As a result, the chances for the stone formation that will be less. But instead of that, if we use the furosemide, whatever the problem you will see over here, see the furosemide that will increase the calcium excretions through the urinary systems, through the tubules. At the time, whenever the calcium that will go through these portions, there is a chances for the calciums to get precipitated over there. As a result, we will see there is a chances for the formations of this stone again. So that's why we are not supposed to use this one. And as far as the dietary things is concerned over here, we should continue the calcium intake as far as the recent study is concerned, and we can inhibit the sodium intake over here. Okay, now we'll go to the second type of the stone, that is known as calcium phosphate stone. Okay, let's go over there. Okay, calcium phosphate stone. Okay, let me show only these portions over here. So the second type of the stones is the first one, the calcium oxalate. Second time we can talk in terms of the calcium phosphate stone. Calcium phosphate stone over here. Okay, now we are talking in terms of the calcium phosphate stone. In this case, definitely the calcium that will be elevated. Now if we get hyperparathyroidism, in these cases there is a chances for the calciums to get elevated, and whenever one thing will get over here, whenever we will get the multiplications for the calcium and phosphate, that will be more than 55. Whenever the multiplications value, whether the calcium will be more or the phosphate will be more, but ultimately the multiplications will be more than 55. And whenever we will get, there is a chance for this calcium that will get bind with the phosphate, and they just do the chelating. After doing the chelating, they will form the calcium phosphate. So they will form the stones over here. Okay, and what type of the stones or shape of the stones will get over here? On the microscopic findings, we will get the shape of the stones just like this. This is known as a rosette shape or rosette shape stone or rosette shape stone over here. Okay, now we'll talk about the triple stone. Okay, that's all, triple phosphate. So let me show over there. I think little bit space is left over here. Now triple phosphate, don't think that the 3-phosphate group, 3-phosphate ions will be over here. I will say why. Triple phosphate stone, third type, we write it over here. Now see, in terms of the triple phosphate stone, whatever the thing will get over here. See, in these cases basically we will get the 3 compounds or the 3 elements or the ions, we can say. We will get magnesium, we will get the ammonium, we will get the phosphate over here. Okay, now whenever we will get the, by the combination, that's why it is known as triple phosphate. We will get the magnesium, we will get the phosphorus, and we will get the phosphate over here. So magnesium, ammonium and phosphate. Now whatever the thing will get over here, whenever we will see there is a chances for this type of the development of the stone, at that time there we can get the presence of one type of the bacteria that is known as Proteus mirabilis. Proteus mirabilis. Okay, so Proteus mirabilis, that is what, urease positive. There is the urease, Proteus mirabilis, that is the urease positive. Whenever it is urease positive, it is having the capacity to convert the urea into ammonia. And whenever it will be able to convert the urea into ammonia, we will get definitely what? We will get the alkaline pH, Within the urine we will get what? Alkaline pH. And within the urine, whenever we will get the alkaline pH, within this alkaline pH, these three things, that three elements, magnesium, ammonium and the phosphates, they are able to combine with each other. Okay, so this is the pH dependent, and which is, if we talking after the calcium oxalate, this is the pH independent. Okay, so this is the pH dependent. Stone formations will get over here. So by the alkaline pH we will see the the magnesium, the ammonium and the phosphate, they will get combined with each other and they will form the stones over here. Okay, now we'll talk about microscopic findings. Whatever the stones we will see over here on the shape of these stones, the microscopic findings will get over here the coffin lid. Shape of this stone, that will be just like the coffin lid shape. Okay, now the third groups of the stone, that is done. So we did talk about calcium oxalate stone, then we did talk about the calcium phosphate stone, then we did talk about the triple phosphate stone. Now we'll talk about urate stone. Okay, urate stones. So let's write it over here. Number 4, we'll talk about urate stone. Urate stone, that means that is responsible for what? Depositions of the uric acid. Depositions of the uric acid. In these cases, we have to know whether the individual is what? The uric acid is getting deposited within the body, within the urine. That is for less excretions or overproductions. That means we can say whether the individual is having the under excretions or overproductions of the uric acid. So that may be the two reasons for it. Whether we can get the overproductions of the uric acid, or we can get the less excretion. For that thing, we have to analyze the urinary uric acid for 24 hours. For 24 hours, we have to do the analysis. And if we see, try to understand, if we see that whether it is the overproductions for the uric acid, or if we see the less excretions of uric acid, then what are the thing we'll get over here? If we see the less excretion, we can use probe in a sheet. And if we see that what? The overproductions of the uric acid, we have to use what? Allopurinol. For the overproductions of the uric acid, we can use the allopurinol, and for the less excretions, we can use the probenecid. Okay, this type of the drugs we can use over here. Now let's talk about whatever the shape we will get over here in this cases of microscopic findings. So in these cases, on the microscopic findings, we will get a point shape, and we will get this type of the shape we will get. Now we did talk about what? First the calcium oxalate stones, then we did talk about calcium phosphate, then we did talk about the triple phosphate stone, then we did talk about urate stones. Now we'll talk about the hardest stone, that is known as the cystine stone. We'll talk about the cystine stone over here. So let's try to show over here. Cystine. So the cystine stone. The cystine stone, definitely the cystine amino acids, sulfur containing amino acids. In these cases, whatever the thing will get. Okay, let's write it over here. This is the hardest one. That's the hardest stone. Okay, this is the hardest stone we'll get over here. And along with that, we have to know whatever the microscopic findings for these things. That means under the microscope, if we see the stones, what type of the thing we'll get? We'll get a hexagonal shape. Now these are all types of the one. Another is xanthine, that is no need to know. Okay. So I'll talk about right now the clinical manifestations of the kidney stones. Whatever the clinical manifestations we'll get over here, those things. Okay. For that thing, okay, let's erase some persons. Let's erase this part only. Cystine containing. Okay. Now, if we say in terms of the clinical manifestations, what are the clinical manifestations we'll get over here? We'll get the flank pain. First, we'll get the flank pain. Now, see, when you are talking in terms of the flank pain, definitely, when you in the junctions in between the ureter and the pelvic regions, if you get the stones, try to understand if the stones are getting degraded. So there is a chances for the degraded particles. That means whenever the stones that will be broken down into the pieces, some portions of the pieces that can go to the ureter. So that can cause, okay, the flank pain that can radiate. You can write it over here. The pain can radiate where within the umbilical regions, umbilical or region, or you can see the pain that can go also where within the genitals or genital system. That means when you go to the genital organs, at that time you can see the pain at the tip of the penis, or you can see also what the pain in the testis or scrotum. You can write it over sometimes. In terms of the female, if you see in terms of the female, you can see the pain where we will see the pain in the labia majora. Another most important clinical manifestations for it, that will get the vomiting. Now, why will get the vomiting? For developing the estrogen, that's most important to know. Try to understand whatever see there are some nerve endings. The nerve endings that is coming where within the in the junction in between the ureter and pelvic organs. If we say in the pelvic regions and the ureters over here, whatever the nerve endings are over here, whenever they will get compressed for developing the pain, the same types of the nerve endings that are present were within the pyloric regions of the stomach, So whenever this nerve endings will be activated, at the same time simultaneously we will get the nerve endings that is getting got innervated were within the pyloric regions of the stomach, that will be also stimulated, and whenever that will be stimulated, that can cause the vomiting. That's why this type of the vomiting that is known as rhinogastric vomiting, or you can say the rhinogastric reflex over here. Okay, so whatever thing will get, this thing is known as a rhinogastric reflex, or rhinogastric reflex we can get over here. Okay, so we'll get the vomiting, we'll get also what? We'll get the flank pain that will radiate to the different regions. Okay, and what type of the investigations we'll get over here? In terms of the investigations, you have to know also what can we do, the investigations. Okay, let's hear some questions from here. So what can we do the investigations in these cases? As far as the investigation is concerned, we can just do the CT for the abdomen. We should prefer the CT. We know that most of the students, they will say we can do the USG ultrasonography, but we can do the ultrasound, but the problem is that is the for the motor ratings and other kinds of the things will get over it. That's why the CT is more preferable, but we can do the USG, the whole abdomen we can do over here in these cases. But once we are getting that, yes, we are confirmed this, the stone is over there. Now we have to know in terms of the size of the stones. If we get the size of the stone, for example, more than 2 centimeter, and if we get the size of the stone less than 2 centimeter, what should be the procedure after that? Okay, that I am going to talk now. If we get more than 2 centimeter, yes, if we get more than 2 centimeter, we are supposed to do precutaneous nephrolithiasis. Okay, and if we get less than 2 centimeters, we have to do extracorporeal shockwave. Yes, if we get more than 2 centimeter, in these cases we have to do, okay, and if we get less than 2 centimeter, in these cases we have to do extracorporeal, okay, extracorporeal shock wave. Okay, and what about if we get more than 2 centimeters, in these cases we have to do precutaneous. Okay, let's write it over here. Precutaneous nephro. With the surgery, you have to do these things. Okay. Now, what about the different kinds of the management? I have already said in the different kinds of the, if I have already said in terms of the calcium oxalate, we have to use what? The thiazides. We are not supposed to use the furosemide. Okay. And in case of, the ureate, I have already said if we get the overproduction, so we have to use what? The allopurinol to reduce the productions of the uric acid. If there is less excretions, we can use our probenecid in these cases to increase the excretions over here. Okay. And in terms of triple phosphate, yes, in terms of the triple phosphate stone, we have to do the treatment by using what? Antibiotics, because we are getting the Proteus mirabilis over here. So you have to use the antibiotics. So these are the terms of the different kinds of the stones and what types of the investigations you can do and the treatment as well. So if you understand, please do like and subscribe. And if you don't get any point, you need to read the whole video. Please let me know in the comment section. And see you in the next video with the new topics. Thanks for watching.